The game plan for the 2010 U.S. Senate race in Pennsylvania changed dramatically when incumbent Arlen Specter switched from a Republican to a Democrat. It made his rival, Pat Toomey, the GOP frontrunner. Toomey represented Pennsylvania's 15th congressional district from 1999 to 2005. He's also the former president of the Club for Growth, a political group which supports tax cuts, school choice, and deregulation. Mr. Toomey, it is a pleasure to have you with us once again.
Thanks for having me.
To talk about this candidacy, why is it at this juncture that you decided this was a really good time for you to run again?
Well, I just feel strongly that with one party in complete control of the elected government in Washington, they're really adopting some policies that aren't good for the country. Some extreme policies, some very liberal policies, serial bailouts, staggering amount of spending, unprecedented deficits and debt, huge tax increases, policies that are not good for Pennsylvania, they're not good for our economy. And I think I can win this race. I think I can provide some balance in Washington, and I think I can push back a little bit and help remind those guys of where prosperity really comes from. It comes from a free enterprise system.
But you came very close in 2004 in that primary against Specter. What makes this particular time, though, critical for you, now especially that Specter has become a Democrat?
Well, it's such a different environment, of course. I'm very confident I'll be the Republican nominee, and that means I'll be facing either Arlen Specter or Joe Sestak in a general election, so it's a totally different election environment. It's a different cycle in the sense that today the Democrats have complete control of the government in Washington. Republicans are really the party of bystanders. When I ran in 2004, Republicans had complete control of the elected government. So it's very, very different. But again, the critical thing for me is the path that our country is heading down. I'm very worried about the policies coming out of Washington, and I think we need some changes.
Are you worried about President Obama's leadership?
In some instances, I am. You know, I've given the president credit when I think he deserves it. I think, for instance, recently when he spoke to school kids, he had a very uplifting and a very encouraging message, and I put out a press release praising him for encouraging kids to work hard and stay in school. But in other instances, I think he's missing an opportunity. On this health care debate, for instance, I think he's not listening to a lot of the American people. He's not listening to Republican alternative ideas, and I'm afraid he intends to go down a road of a partisan, really extreme bill that will inevitably cause people to lose private coverage, drive people onto a government-run plan, and so I think in that sense he is missing an opportunity to provide better leadership.
But isn't it true, though, that insurance, health insurance, is so high for so many people that they really do need some type of alternative?
Absolutely. We definitely need to fix some of the things that are broken. It is too costly, you're right about that, and there are many Americans and many Pennsylvanians who have trouble getting access to the health care they need. We should focus on those problems and not turn the whole system upside down. So I've advocated, for instance, that we provide individuals and families with the same tax cut that employers currently get if the employer buys health insurance. Why shouldn't that be available to a worker who needs to buy his own insurance? I think we should have more competition because we have too few insurance companies that dominate the Pennsylvania markets. So we should allow people to buy insurance from all across the country, any of the 50 states. That would provide more competition, more choices. And I think tort reform needs to be part of this too. You know, we do spend a lot of money on litigation, on malpractice insurance, and practicing defensive medicine. Those things I should think we could get a bipartisan consensus on that would help lower costs and provide more access.
Even in terms of malpractice insurance, there are doctors who have left the state of Pennsylvania because it is just too expensive to do a medicine that they love. How do you fight that?
Well,
how do you fix that?
You're exactly right. Well, I think you put some limits, especially on the non-economic damages. Nobody's talking about putting limits in terms of a patient's ability to recover the cost of lost wages or their own, therapy for whatever went wrong. But the non-economic damages, the pain and suffering numbers, that sometimes there's a lottery mentality that is very, very expensive to health care. And the thing to keep in mind is this: it's also a question of access. We run the risk that we won't have enough obstetricians to deliver all the babies that we want to have in the state. There are fewer neurosurgeons than we really need in Pennsylvania. Orthopedic surgeons are a specialty that have to pay a devastatingly high price. So it's true that not all doctors have to pay exorbitant and really unaffordable medical malpractice insurance, but some do, and some are leaving the profession.
What's your position on the public option that the president has presented?
This is a mistake, I think. We need more competition. We can do this through lots of competing private firms from all across the country. That would give the competition that the president says he wants to create. But the government plan has some serious flaws. It'll reimburse healthcare providers at much lower rates than private plans, and that's going to be a problem for many hospitals especially. It's a plan that, because of that subsidy, it's going to drive people off private insurance. Employers are going to have an incentive to drop their private coverage, forcing people onto the government-run plan. And ultimately, government-run plans end up putting bureaucrats between the doctors and patients, where bureaucrats start to make the rules and decide what kind of treatment you get under what circumstances, and depending on what age you are, that sort of thing. I just don't think we want to go down that road.
In terms of healthcare, you have met with Joe Sestak.
Yeah.
You also have hosted healthcare forums. What is your point of view about people at some of these forums who really have created an acrimonious environment?
Yeah.
In the midst of the discussion?
Well, as you know, Joe Sestak and I stood on a stage together at Muhlenberg College in Allentown, spoke before 400 people and live TV cameras for an hour and a half. And we have very different views. You know, Joe has a very liberal approach to this. I have a different approach. And yet it was never acrimonious. It was never nasty. There was no name calling and no rudeness. You know, I think we need to have a discussion about health care because the issue is important and it needs reform. But there's no place for angry rudeness and nastiness. I hope we can have a constructive discussion.
Do you have a position, however, on the individuals who have come and seem to be organized around a different kind of message, where there's a constant sense of interruption and forcefulness on their part, where there really is this angry debate, not necessarily between the two candidates or the two individuals who are trying to talk about it, but really among those who are attending, and perhaps fueled by political action committees or other kinds of groups?
Well, I would say to the extent that people are going with the intention of being disruptive and being counterproductive, then I would certainly not encourage or support that. But to the extent that people go because they have sincere questions and genuine concerns about what's happening, then that's a very encouraging form of American participation in politics.
Yeah, let's talk about another issue that's really critical, and that's foreign affairs, and especially the war in Iraq, the war in Afghanistan. There are some who believe that we just should not be in Afghanistan any longer than perhaps the next 10 minutes. What's your point of view about that?
Yeah, listen, I mean, obviously it's very troubling, and the recent resurgence of the Taliban and the escalation in the number of American casualties is very, very disturbing. But when you consider that this very country was the host for the al-Qaeda terrorists that attacked America, killed 3,000 innocent American lives, I don't see how we can allow this country to slip back into the hands of the very people who hosted those terrorists. So I think it's important that we continue our commitment. We probably need to change tactics along the way. We'll have to do that inevitably, but it's important that we stay and win.
Are you comfortable with more troops, another surge of troops as we did in Iraq?
I think at this point it's probably necessary to have some more troops on the ground in Afghanistan. I think the president's been right to commit more troops to Afghanistan. It's very, very important that we secure a reasonable semblance of a stable and democratic society there. It's too important to walk away from. And
tell me this, especially because of running against Arlen Specter in 2004, why do you think that Arlen Specter should not go back to Washington?
I think the problem with Senator Specter is that the only principle that's important to him is his own re-election. You get up in the morning, you don't know which side of an issue Arlen Specter is going to be on. You know, he was in favor of card check, you know, the legislation to deny workers a secret ballot. Then when he saw me coming in a primary, he was opposed to it. Then when he decided he couldn't win the primary and he joined the Democratic Party, he's in favor of it again. He's done a similar 180-degree reversal on the government-run health care. That kind of sort of cynical political opportunism, I think, there's no place for that. In the U.S. Senate, we need leadership, we need principled leadership, and he's not providing it.
Can you predict who your opponent is going to be?
I sure cannot. I think they're going to have quite a battle, and Democrats are going to decide, do they want a principled liberal, who Joe Sestak is? I think he's a good man. I think he believes in the liberal agenda that he advances. Or do they want this political opportunist who you just don't know what he believes in? That's up to the Democratic voters to decide, and I'll be prepared for whoever they pick.
All right. Pat Toomey, thank you very much.
Thanks for having me.